A crisis tonight for the state's largest health care plan. We have learned that Medi-Cal needs a massive bailout to continue coverage for 15 million low-income people, which this year, for the first time, includes the undocumented. KCAL News political reporter Tom Wade is here. And Tom, tell us what's going on.
Well, yeah, so it's a pretty complicated issue, and Democrats say, these things happen. There's a line in the budget, and sometimes it doesn't line up with what happens by the end of the year, and they solve the problem. But Republicans have a very different opinion here, as you can imagine. So late last week, the governor had to ask for an emergency loan of about $3 billion to keep Medi-Cal from going broke. Well, tonight, we've learned it will need twice that amount to stay afloat. State Republicans say they predicted this crisis a year ago and say the recent move to ensure the undocumented is a big reason for the crisis. Tonight, a crisis in Sacramento. The health plan that serves 15 million Californians, mostly low-income people, is deep in the red. Democrats, who have a supermajority in the legislature, will have to find an extra $6 billion to keep the health care plan for low-income residents from crashing. Republicans are blaming Democrats for extending coverage to 1.6 million undocumented residents.
We're not surprised. I mean, we saw this coming a year ago when they legalized adding all undocumented immigrants, illegal immigrants, onto Medi-Cal and providing free, unlimited universal health care. And at the time we asked, is there a limit on how many people can join? They said no. So we're not surprised that the program has basically become insolvent to the point where the governor had to request a $3 billion loan last week. And then just yesterday, they revised the numbers even more.
Caught in the middle, millions of low-income Californians. Providers that work with Medi-Cal fear the possibility of future cuts. Even the smallest could be devastating.
We serve about 82,000 patients annually, and so cuts to Medicaid would be a loss of patients being served in the thousands. And what that'll mean is that these patients who will no longer have coverage will end up then going to hospital emergency rooms and really then impacting the safety net of the entire community.
The issue of allowing undocumented people to enroll in Medi-Cal is a major political issue. It's also a complicated one.
Undocumented people contribute to the economy of California, pay taxes, pay Social Security taxes, even though they don't qualify for Social Security benefits. But the politics of the issue is very difficult and is likely to become even more difficult in the months ahead.
Democrats defend the bailout, saying Medi-Cal saves the state money in the long run.
This is something that we know is solvable, and it saves us money in the long run to keep people out of ERs, to make sure that we are supporting hospitals, which literally could close if they lose Medi-Cal funding. Part of it is we're a success story. Part of it is that we actually did what we were supposed to do, which is make sure people don't die because they don't have health care, don't go bankrupt because they don't have health care.
Democrats say a much larger crisis could be looming. They say President Trump wants massive cuts in the federal health care spending, and the feds sent $100 billion to California last year for low-income residents. That's more than half of Medi-Cal's entire budget. So, Pat, we'll have to see where this goes.
And thanks so much for breaking that down for us, Tom, and staying on top of it.
Thanks, Pat.
Okay.